Thank you for joining us for the ehrTHOMAS Encounter tab help video. The Menu tab allows the users to create a new encounter, view previous encounters, and begin the charting process for a patient note. An encounter is designed to be used each time the patient is treated within the office. This takes the place of paper route slips, encounter forms, and exam forms an office uses for the patient's visit. Entering information into an encounter will begin building your progress note for patients. To create a new encounter for the patient, click Create New Encounter, or click the New button at the bottom of the menu screen. Each new encounter will begin with the current encounter header. This screen prompts the users for specific details about the encounter. The user is able to indicate the other providers that are associated with the patient's care team from there. The claim header information for the encounter can be initiated here and sent over to ehrTHOMAS. If a care plan is needed, you can select the care plan here. On the right-hand side, you can select a care plan from a list by searching for the care plan or scrolling through the list of plans. This will add the selected care plan to your encounter. We will go over care plans in a later video. Now we're going to go over the different fields in the encounter menu. The visit checkbox is used to indicate if this encounter was an office visit. By checking this box, you are also indicating that information charted for this visit will be calculated in system measuring reports. The encounter date is the date of service. Today's date will be the default when creating a new note. Encounter dates cannot be set for future dates. However, they can be set to previous ones. Select the place of service number from the POS dropdown. Click the location search box to select the location for the visit. The location is equivalent to who is billing for the service. The location will default to the first location. The user will need to set the appropriate location if there is more than one location for a practice. Changing the location will change data presented on the patient note. If the services are being performed at another facility, such as a hospital or nursing home, click the Facility Search button to indicate the correct location the services are taking place. Select the encounter type from the Encounter Type drop-down box. This can be used in different ways, such as to define why the patient is being treated, seen, or consulted, or can be used to distinguish encounters by specialty. Select the Note Template from the Note Template drop-down box. The Note Template defines how the patient note will be formatted. It also designates the note that the provider will sign off on. Select the patient's transition type from the Transition drop-down box. The transition type defines how the patient came into the office, such as referral, consult, or none. The options are hard-coded in ehrTHOMAS. The Transition Out checkbox is used if the patient was sent out of your office for a consult or referral to another physician. Click the EM type search box and select the appropriate EM type for the visit. This is an optional tool. If an EM type is used in the encounter header and using the EM suggestion helper, the EM codes that the system will use to suggest will be confined to the EM types selected. The user may always change the type either on the header or through the EM suggestion helper. The Care Team tab allows the user to record different providers that are associated with the care of the patient. The Header tab allows the clinical staff to enter in important claim header information to be sent to ehrTHOMAS through the Send Charges feature. Clicking on Save will allow you to save the encounter header information and start the charting process for your patient. Clicking on Cancel will cancel the encounter altogether. Once the encounter header is saved, it will bring you to the main charting screen for your patient. Open encounters are charts that have not been finalized and signed by the provider. Click on the Open button at the bottom right of the patient's chart to see all of the open encounters. This screen will show you what encounter you are currently on at the top of the screen and list all of the open encounters for the patient. Each open encounter will be listed with the date, the time the encounter was created, the performing doctor's code, if the encounter was a visit or a non-visit, the type of visit, and if a care plan is attached to the encounter. Clicking on the Continue Current Encounter will bring you back to the menu screen for the encounter you are already on. Clicking on Create New Encounter will open up the Encounter Header information screen to set up another encounter for the patient. To open an encounter, click the Select button and the system will bring you back to the menu's charting screen. On the Open Encounter screen, you are also able to delete an encounter and all of the events associated with it by clicking on the red X on the right of the encounter. You can select a previous encounter using the Patient Encounter Timeline or the Open button through the menu screen. The Patient Encounter Timeline is displayed at the bottom of the chart. Each piece of paper with a date on the timeline indicates a separate encounter. The lock icon on the encounter indicates that the encounter has been signed by the doctor. The number associated with each encounter on the timeline represents the number of modules filled out on the patient's chart. The star on the encounter indicates the current encounter you are on. Hovering over the encounter on the timeline will show more information regarding the patient encounter. You can use the left and right arrows on the timeline to move backwards and forwards through the timeline. If you need additional help or have further questions, please call the Genius Solution EHR Support Department at 586-751-9080, option 7. Thank you.